Hey everybody, this is Kerry Coleman with Terry Health, and we have a special guest today, Dr. Michael Ward, sports medicine expert. And Dr. Ward, thank you for being with us today.
Well, thanks for inviting me.
Yeah. So, Dr. Ward, can you just give us a little bit of about your personal journey, like what got you into sports medicine,
Okay.
and a little bit about your practice?
Okay. So I'm actually family practice and sports medicine.
Mhm.
So I have a board certification in family medicine, but also in musculoskeletal or non-surgical orthopedics. So I started off as a youngster. I grew up in Inglewood, and my parents were um, pretty much a stickler on trying to make sure that you don't get out of hand, and the neighborhood can draw you into all the, the potential complications. And so, um, as I grew up, I saw most successful people being people like bus drivers and the mailman and teachers and things like that. And pretty much my family was like, nah, there should be more out here for you, And luckily, I grew up in a two-family household, so they kind of kept me under their armpit, just like, hey, keep you under control so you don't get out of control. And so, as I went through grade school and high school, and during high school, I played sports like I wrestled and ran track, and then um, I as I went to college, the my parents were like, well, my dad in particular was like, man, you need to get out of the city because this area is really not good for you, and you can get caught up with all of the riffraffs and things of that nature. So I went to Fisk in Nashville, and I completed a biology degree at Fisk, and I did a master's degree at Tennessee State in developmental biology. And I came home and worked in transplant surgery at U of I. So while working at U of I in transplant surgery as a technician, I was doing organ matching, tissue typing for kidney transplant patients, and eventually became liver transplants as well. But I wasn't getting paid much. Um, the amount of student loan debt that I had was probably a lot higher than the amount of income that was coming in. So I was interested in being a physician all along, but I guess the discipline quite wasn't there. So from there, I got into med school at Rosalind Franklin University in North Chicago, and I did a family practice a residency at Mount Sinai in Chicago, and then did a sports medicine fellowship at Henry Ford in Detroit. And when I first came back to Chicagoland, I started working with Barrington Orthopedics, doing pretty much just all orthopedics. But eventually, they were in Schaumburg and Hoffman Estates, and I lived in Bronzeville, so that was a long haul. So over time, it became a little bit more of a travel issue, being on driving to the other side of the airport every day. So from there, I came and moved in on the south side of Chicago and became an employee of Advocate, doing family medicine and sports medicine in Richton Park. So from there, I contacted two schools in the area and then became the team physician for those schools, Rich South and Rich East. Uh, as time went on, I eventually became self-employed, and I moved my practice to Homewood. And I was still covering Rich South, and at that time, I started covering the sideline events at Thornton. So I see a lot of the athletes in my office, but also I would see a lot of other people, like some of the parents and the athletic trainers and the teachers and the instructors and some of the doctors from the hospital and some of the attorneys in the area. And so I was dealing with a lot of blue collar workers, but also those that were going to work every day as an accountant, a lawyer, and things of that nature. And so as time went on, when I developed my practice, I got busier and busier, and so um, the the athletes eventually, a lot of those guys continue to follow up with me after they've graduated from high school, and eventually I became the team physician for Homewood Flossmoor, and now I'm covering Rich Township because Rich East, South, and Central have combined. So I'm also the ringside physician for the state of Illinois. I cover a lot of professional and amateur boxing, kickboxing, and MMA events. So when they have like the UFC downtown, or they have the amateur Golden Gloves and things like that, they call me and say, "Hey, can you do the ringside physician coverage for us?" So what that entails is doing physical exams on the boxers and the competitors, because it depends on what events they're doing. And I also sit at the ringside and evaluate whether they've had head injuries and things like that. And still now I'm still doing covering sideline events at Rich Township, and as well as home of Flossmoor. So I'll go to some of their events like wrestling tournaments and things like that, and dealing with a lot of musculoskeletal things like, seeing a couple guys with dislocated elbows, one with dislocated shoulders, and we'll try and reduce them on the sidelines, and then just evaluate and work with the team trainers to try and make sure the athletes are healthy. So to this day, a lot of athletic trainers will text me and say, "Hey, can you get this guy in? He had a head injury, and I think he had a concussion. Can you evaluate him?" And so I try to get them in. But I'm also doing family medicine. So in my office, I'm seeing people with diabetes, hypertension, arthritis of the lumbar spine, osteoarthritis of the knees, shoulders, things like that. So I do a lot of injections for people like carpal tunnel syndrome. I'll do some injections for osteoarthritis of the knees. People with plantar fasciitis, I'll inject the plantar surface of the foot, tennis elbow, rotator cuff syndrome. So I deal with a lot of people with arthritis, even though they may not be athletes.
Mm.
So that's currently what I do in the office. I don't round in the hospital anymore. I've done that until my volume picked up. And then when my volume picked up so busy that I was so busy, I wound up employing other providers. So I've got uh, two part-time nurse practitioners and also a physician assistant that works with me in the office as well. So that's pretty much what brought me to where I am. Um, I guess the sports medicine aspect of it was interesting to me because I was playing sports. I played football 2 years in college, and like I said, ran track and wrestled. And with that being the case, I had a lot of musculoskeletal injuries and things like that. And we had the athletic trainers and things that would address the issues. But specifically, I remember at Fisk, I injured my knee, and I was sent to um, Meharry across the street from Fisk. And the little did I know, they lost their orthopedic accreditation. And over time, the gentleman would continue to drain my knee, and it was just so painful. I said, "I'm not coming back. I'm rehabbing." And so I started going to the gym and working out, and I was able to play again the following year.
Yeah.
But over time, I wound up realizing, playing basketball one day in the gym at U of I, my knee started swelling up. So I went to the orthopedic surgeon, who actually happens to be, his name is Hutchinson. He's actually was the team physician for USA Hockey. And he said, he scoped my knee and said, "Hey man, your ACL's been torn for years." He said, I can trim up your cartilage, but your ACL's been torn. You've got arthritis in your knee, and by the time you reach 40, you're going to need a new knee replacement. You're going to need a knee replacement. So, when he woke me up, I said, "Just do what you can." He, put me back to sleep and finished doing what he did. But from then on, that kind of gave me some inspiration to go into sports medicine, because it was something that was missed by the orthopedic guy at Meharry. So I'm pretty sure they've gotten their orthopedic accreditation taken care of. But at that time, things were a lot more financially, a little bit more interesting financially down in Nashville. So
Yeah.
um, they did a better job, and then that kind of inspired me to look up musculoskeletal things. And to this day, I hook up with a couple of orthopedic surgeons who were telling me, "Listen, man, 80% of our injuries are non-surgical. Can you address those and send me cases that have been worked up already?" So to me, that was a pretty good signal that, listen, anything that is going on with you, someone needs to work it up first. And the orthopedic surgeon's like, "Well, I see his patient, so that means I need to schedule him for surgery." So they know that, let's say for instance, a guy has a shoulder injury, and he can't lift his arm above his head, and he's having pain and things of that nature, here to snap or pop in his shoulder, and I get X-rays and it doesn't show anything, or I get an MRI and it shows he's got a rotator cuff tear. Then I know I need to send this guy to the orthopedic surgeon, because the next step is surgical repair.
Gotcha.
And so they're like, "Listen, thanks a lot, because we want to go straight to surgery with these people, because of course that's more what they're interested in doing is cutting.
Yeah. So,
Yeah.
Mike, we go back some years.
Yeah.
We go back to when I got back from Iraq. So that was like 2006. So and I'm hearing the wrestling because I'm like, I want to ask so bad, like, what weight you wrestling? Because I've been wrestling, jujitsu, MMA, and a lot of my buddies, it's just like you said,
Mhm.
you have these armbar, uh, uh, ankle locks, and you have all these heel hooks and all this. So there's a lot of jujitsu, wrestling, and MMA injuries. And you actually,
Mhm.
I was gone. I was gone because we were on the same age. I was gone when you got to Thornton, when you was working with Thornton.
Mhm.
Because I graduated from Thornton. We moved from the South
Okay.
Side, from Roseland out to Thornton, out to Harvey, and
Okay.
I went to Thornton. So, but you got my wheels turning because a lot of people that I work with are ex athletes.
Mhm.
A lot of my buddies, it's like almost all my buddies fight
Okay.
jujitsu, wrestling, boxing, MMA. We all fight, and
Right.
everybody got injuries. But at my age, we expected, but we got them back in the 30s and 40s. So, I think this is something that people shouldn't wait until, like I said, you don't have to be, on a team to come see a sports medicine professional. So, if you can just give us some, you had touched on some things, but if you can give us some like evidence based approaches to like how to prevent some of the most, like what are some of the most common sports injuries that you see? Because like I said, a lot of the guys want to fight. You wrestle, I wrestle, I
Mhm.
still do jujitsu. A lot of guys are going to the jujitsu, kickboxing schools because they're not going to do football or basketball because you 6'7", but you can't dunk like you used to because of your knees or whatever. So, but a lot of guys want to be active. They get gym
Mhm.
injuries. So, what are some of the most common sports injuries that you are seeing right now? And like, what are some of the approaches that you take for these?
So, so some of the one of the most common uh, sports related injury is actually an ankle sprain. And so a lot of people are either running up and down the court or, like you mentioned, performing MMA and getting heel locks and things of that nature. Um,
Mhm.
I think the most important thing that I've noticed with some of the athletes for the schools that I cover is a lot of those guys don't have their shoestrings tied. Something simple, just have socks on, but the shoestrings aren't tied up. If you know you're performing a sport that actually could potentially result in an ankle sprain, which is the most common injury, tie up your shoestrings. And some of them have high tops, but they don't tie their shoestrings up. So another thing that I found more common and more prevalent in the African American population is a lot of people are flat-footed. So if you're performing sports and you're flat-footed, your arches start falling and your feet do what they call pronating. That means that the inside of the feet start flattening out, and that makes it more likely to have an ankle sprain. So to avoid those kind of things, they want to you want to make sure that they have heel lifts and orthotics and comfortable shoes. So some of our people are financially strapped, and I know with the problems that they have is just okay. I want to make sure my gym shoes last a little bit longer than they should. But if you're actively participating in shoes, you want to make sure you have some pretty decent shoes and have some heels, some insoles in them that will help keep your arches up and prevent those ankle sprains. So that's one of the more common preventative measures. Another thing that I notice is in a lot of these high school or athletes, for instance, in baseball, guys are playing baseball for the team, and then in the spring they're playing spring ball, and in the summer they're playing summer ball, and so there's something called sport-specific injuries. So let's say, for instance, a athlete is a pitcher. There's a concept of pitch count. So you want to make sure that uh, each team knows that you're playing on the other teams too. Because if one coach is thinking, "Hey, he's only playing for us," and the guy and he leaves and goes to another team and plays for them, and he thinks the same thing, then he'll eventually start having elbow pain or the shoulder pain. So in athletes, there's something called apophysitis, meaning there's a growth plate where new bone is laid down in the growth plates, and that's the area of more susceptibility for injuries. So when you look at a growth plate on an X-ray, it's just a black line, and sometimes those guys can have a fracture, and the X-ray won't even show it because it's a black line on the X-ray. But it's pretty much just a physical exam finding saying, okay, well, this guy either has apophysitis, which is where his growth plate is growing and it's kind of sprained, or there's a Salter one fracture, which is a fracture right across the growth plate. So the fracture right across the growth plate can impair growth in kids. So you don't want to have one leg longer than the other because you had a Salter fracture in the tibia and didn't know. The other thing is something called little leaguer's elbow. There's something called, um, like I said, apophysitis of the heel, of the shoulder, of the hip. So those are all injuries that people can have as, let's say, high school athletes that are really, really pushing it, but it's more susceptible in people that are doing the same sport year in, season in and season out. So it's probably better. What we like to tell our patients now, it's probably better to alternate your sports. So if you're playing, rather than playing baseball, in three different seasons a year, it's probably better to play, let's say you play basketball during the basketball season, even if you run track during track season or play basketball during that season. That way you don't have the same motion all the time doing the same motion in which would increase the risk of having tendonitis or even injuries to that elbow. And we see now a lot of youngsters are having what they call Tommy John surgery, which is elbow surgeries from um, they've injured the lateral collateral ligament, the ulnar collateral ligament of the elbow, and so they have to undergo surgery because they've been throwing curves at an earlier age or throwing too many pitches. So those are things that we want to kind of keep an eye on with young athletes.
You know what? You mentioned the pitching and the pitch count. I remember when I was it was Harvey Little League baseball. They had to sub out the pitcher after either so many innings. I guess they counted innings of
Yeah.
pitching. And my coach, Mr. Cole, he was a stickler. We know because when we first started, it was like 9 to 12 or 9 to 13. Until you was closer to that 12, 13 year old, he didn't want nobody throwing curveballs.
Mm-hmm.
He was
Yep.
like, you can't throw that yet. And I didn't
Yep.
understand. Oh man, he just don't, he didn't want certain ones because I was a catcher. I pitched once or twice, but I was a catcher. And I'm trying to tell him, hey, throw this. But it was the older kids that he will allow to throw curves,
Curves.
sliders, and all. Other than that, you younger and you learn how to pitch straight fastball, get it in the strike zone. And he
That's
was
the
saying,
reason
he
for
was
that.
tell us, we never say, he was like, your arm is too young for that. He would say stuff like that. You ain't ready for that. But it's like I kind of understood because some of them, like I said, they would throw out their rotator cuff. But as an adult, it makes sense now. Now, here's something else you're touching on that's making me think. Is my son plays soccer year round. Now, I know about overuse injuries, but yet it's like you're not thinking about it. You think about it with yourself, but you don't think about it with your kids. Like, well, I'm tired or I'm a little something like, so you didn't really do much. But it's like you're playing year round. A 2 week
Right.
break here and a 2, 3 week break, maybe 4 week break there. But it's like that's something to consider. No matter how good the kid is, it's like he's going to be an adult one day. He'll spend the majority of his life as an adult. So that's something that we need to consider. And it's amazing how you're talking about these most common injuries because you work with kids, but a lot of us are adults who had these injuries, didn't fully understand. All we know is I hurt my elbow or hurt my knee when I was young running track or playing. But as adults, we're still dealing with them. And I think that you know, like what so as it's so let's say like with some of these common injuries, I'm an adult, I've had a particular injury, let's say one of the or old injury that wasn't fully, you know,
Addressed
addressed.
appropriately.
Like some what are some of the things you would recommend for some of these adults with who had some of these common injuries?
So, one of the more common issues that I see with older adults is that they develop arthritis. So,
Okay.
there are four common causes of arthritis. Number one is trauma. Number two is overuse. Number three is heredity. And number four is obesity. So, let's say, for instance, you as a young basketball player took a hit and you fell on your back and injured your back. That trauma to the back can eventually result in some osteoarthritis of the lumbar spine. And same thing with knees. People have knee injuries that eventually will develop into osteoarthritis, shoulder injuries, and those can happen as well. And just like I said, because you got more of the common factors, let's say, for instance, you work for Ford Motor Company and you were a football player in the past and took a shoulder injury, and you working on the assembly line for doing putting on parts on the cars, the chances of you having some rotator cuff syndrome or rotator cuff injuries is high. So I see some of the former football players and now adults come in with neck issues, and so uh, with neck issues, the patients are starting to have numbness and tingling down their fingers. So I think the number one thing you want to do is see your doctor first. If you're going to start a workout program, see your doctor first. Number two, you want to make sure that he knows what kind of injuries you had and what type of workout plan you expect to do. For instance, if you're looking at a 65-year-old guy trying to start high intensity interval training and he's never done anything before, I would highly discourage that guy from doing that because number one, you start having your body has never been used to that kind of workout. Now you want to turn it up to 10 from 0 to 10, it's going to be a little difficult. I mean, of course, almost all of the exercises, and I know you know as well, some of the exercises that you want to promote, there's a beginner's lesson where you start very slowly. So that's probably the key. When we were younger, the common montage was stretch first before you exercise. Now they're telling us warm up first. So let's say, for instance, if you're going to jog, instead of jogging at your normal pace, lightly jog slowly and then work into your regular pace. And then after you finish working out, stretch. So just remember, if you've got congestive heart failure, you've got COPD, it's going to be a little bit more difficult for you to take these cardio up. So you have to work up to that. So if you've had, let's say, back injuries or neck injuries, one of the things that you don't want to do is, let's say, squats with weights on your neck. If you've got paresthesias of the fingers and you've got some stiffness of the neck, and you start doing squats with weights on your neck, you could pretty much cause your shoulders to start tingling. Or if you wake up in the morning and you got tingling in the fingers, and when you get on the expressway, you have a hard time turning your head to get on the expressway. There's something possibly going on with the neck. So if you wind up, let's say, for instance, you having paresthesias or numbness and tingling down the legs, is there something going on with your back? So if you've had ankle sprains and things of that nature or ankle fractures in the past, sometimes that ankle will be bigger than the other one because when the body heals, it lays down new bone, and then that ankle will be bigger than the other one in some cases. Some of us have hand